We do have a caller on hold, so we're going to go to the phone lines where David's waiting for us. Hi, David.
Hi, Tony.
Would you like to share a question or comment?
Yes, I'm curious. Your guest mentioned earlier that some areas of the body are less effective than others, but I am curious, how many times could someone have liposuction done before it fails to be efficient anymore?
That's a good question. I mean, you have to ask yourself with each operation, what are you trying to get? For example, if I did liposuction on your stomach and 6 months later you came back and you say, hey, it's still too poochy, is it too poochy because you put 20 pounds on and now you've sort of reaccumulated fat cells there? Or is it that we haven't taken out enough and been aggressive enough the first operation? They say in the best hands in the world there's a 20% revision rate on liposuction, and from my own philosophy, it's a lot easier for me to go back and touch up an area of liposuction than it is to put the fat back where we want it. Irregularities, waviness are one of the complications that you can have with liposuction. So again, I think you have to temper how aggressive you can be. So how many times can I go back to any one area? I guess as many as a patient would like me to. After a while, you do get enough scarring in that inside layer that it makes it harder to get fat out. But I think myself personally, I can remember going back 3 or 4 times in the same area for patients trying to sort of get them where they want to be.
Thanks for your call. In reference to liposuctions, when we're talking about the surgery itself, can you talk a little bit about the different techniques that might be available?
Sure. There's manual liposuction where I do the work, and it's a workout. I sort of treat the tissues in a variety of ways that people may hear about, called tumescent or super wet or dry, and that just refers to the solution we inject to minimize bleeding. And about 10 years ago something came out called ultrasonic liposuction, or UAL, where a special cannulas were put in and you use ultrasonic energy to bust the fat cells, and then you sort of pulled out the more fatty liquid in a more conventional manner. A lot less work for me as a doctor. But what we found with that is you do have higher rates of fluid collections on the skin called seromas, and there's more injury to the skin, even some burns because of the ultrasonic energy. And then there's also what's called external liposuction, where simply by using an external probe you try and manipulate the fat. Although there's been studies to show it's effective, I don't think anybody's using that as a primary modality. And then finally there's things out there called mesotherapy or lipodissolve, where people are messing around with trying to inject certain chemicals to break down fat and get it to dissolve instead of having to actually physically remove it. The jury's still out on its effectiveness.
We do have another caller on hold, so back to the phone lines. This time it's Darlene's turn. Hi, Darlene.
Hi.
Would you like to share your question?
Yeah, I was wondering, how old is 60 years old too old to have liposuction and tummy tuck, where you would have to have some of the skin removed?
You know, I guess you're as old as you feel, and is 60 too old to do that? I don't think so. I mean, if you're otherwise in good health, you don't have any significant chronic medical problems, heart disease, lung disease, kidney problems. I mean, even diabetes, I think, in the right patient, you can certainly manage successfully. I know a lot of 60-year-olds that are healthier and more active than 40-year-olds I know, so I don't think your chronological age is specifically a reason to do or not to do. Statistically, a female at 60 has another 25 years of living ahead of them, so who's to say you shouldn't be able to be most comfortable in your body for another 25 years? I just think that's something you work out with your doctor and make sure that with everything else taken into account, it's a safe operation. I do think you'll see at 60 your hormones are different, and how you deposit fat and where you deposit it and how quickly you do is something that needs to be discussed, because that does make you a little different patient in my mind than someone who's 40.
Thanks for your call, Darlene. Can you go into hormones a little bit and its effect on fat distribution, both in men and in women?
Well, we know that men and women tend to hold on to fat in different places. When women gain weight, you know, sort of that below the belly button and that poochie area, we call it, is pretty common. Where men tend to get the, you know, they call it the love handles, more in the flanks. And that seems to be kind of a sex-driven predisposition. But everybody's a little bit different. There's some women that come in and tell me every time I gain weight, I gain it in my breast first, or I gain it in my butt first, or my thighs. And the other women say, I can't gain in my breast if I tried, and I'm here to have my breasts made bigger. You know, so not everybody's going to get it the same way. But we do recognize that there are differences between men and women and where they put their extra fat. Men also are more prone to hold on to fat inside their intestine areas, we call visceral fat. So they may come in with a big kind of full belly, and after doing an exam I find out they only have maybe, you know, a couple of centimeters of actual fat outside of where their muscles are. All the fat they're talking about wanting removed is inside around the intestines, and we can't safely remove that. So the only answer for that patient really is to get on a bicycle, get on the treadmill, get into a, you know, a real exercise and diet program, and as their weight goes down and they lose their visceral fat, they'll get the contour they're looking for.
Now, mostly we've been looking at photos of women in regards to these procedures. How common is body contouring for men?
Well, depending on what study you read, you know, up to 25% of cosmetic surgery is done on men. And if you look at the procedures most common in men, liposuction is one of the top, and probably second only to rhinoplasties, or nose surgery. So it's pretty common for men. And the other place we see a lot of men come in that end up with liposuction is for male breast enlargement. It's called gynecomastia. And that just becomes a technique and a tool to address that.
I was wondering if you might be able to touch upon for us perhaps some misleading advertising that might be out there, or some gimmicky type things that perhaps are not in a patient's best interest. I mean, we've all seen the ads where you see, you know, a photograph, say, of a really overweight gentleman, and then all of a sudden he's had surgery done and he looks like Mr. Universe.
Yeah.
So if you could talk a little bit about that.
Well, unfortunately, medical marketing of cosmetic surgery is not always taking the high road, and you have folks out there that can be a little bit misleading, from people they put in their ads that never had surgery, just are naturally thin and lean and have a nice body, to patients that, and I know there's one group ads out there for sort of a weight loss program where they took the picture right after one of the people had a baby, and then she got back to her pre-baby weight through just a natural process and took the second picture. And sometimes they'll try and claim that the results were the result of surgery or a diet program or an exercise program. So I guess the buyer beware. But I think if you're with a reputable doctor that has a good reputation, you're not going to be misled that way. And I think part of my responsibility as a plastic surgeon is to make sure a patient's expectations are reasonable with what I can get for them and what my skill level or experience says we can end up at. Some patients are thin enough where I can etch some of the marks on the abdomen to give them that six-pack look. But for a lot of patients, unless they've got the muscles underneath to support that, you know, you can liposuction all day, you'll never give them that look. So you got to make sure that, you know, like I said, I have to make sure they're reasonable what they're looking for.
We're going to head back to the phone lines. This time it's Karen's turn. Hi, Karen. Would you like to share a question or comment with Dr. Mancoll?
Hi.
Would you like to share a question or comment? You're listening to your delay on your TV?
Yes, I'd like to know if...
Karen, just go straight ahead and ask the question.
You do chin tucks, and what the procedure is?
Yeah, the double chin, or the turkey chin, what some people try and call it. You can do liposuction alone for that if you've got good skin quality. If after a certain age, you know, the skin laxity is part of the problem for you, liposuction alone won't give you that nice tight sort of chin contour. There you have to do a neck lift where you're removing some of the extra skin, and we tend to work that out kind of towards the ear and try and hide the scars either right in front of the ear or even behind the ear. And then there's also a muscle component in the neck called the platysma. And if the platysma muscles have sort of separated on themselves, sometimes we have to make a small incision on their chin and tighten that up as well. But there's a lot of folks that liposuction works great on. It's actually one of the most dramatic places to see the effects of liposuction.
Thanks for your call, Karen.